Okay. So thoracic outlet, right? I'm not sure if you guys are in ortho, but brachial plexus, I can't go through all of it here, so please read over the handout. Entrapment of the brachial plexus, right, can happen in one of three areas, as they say, anterior scalenes, bless you, costoclavicular, costo is rib, clavicular, clavicle, pec minor. Okay. Basically, you're gonna, go for assessing all three of them, or working with all three of them, right? Somebody says it's anterior scalene syndrome. I'm not just gonna be like, oh, I'm gonna work here and then the rest is done. Right? No, you can work with all. So with that, I notice here, this is kind of a fun little divot to play in, right? Anterior to the traps, and kind of just lateral to the scalenes, right? Not a lot of pressure is needed. This can get really pokey really fast. Some people might like that feeling. I'm not a fan of it, so I don't do it. For people that do it, I've seen people really go in here. No need to go that fast. There's not a race, right? And this is very similar to what we were doing when we were feeling that skin drag with our hands. It's just I'm doing it baby with my thumb, right? And yeah, you can veer in a little bit. Just I gotta be watching her face to see if there's uncomfortable little or if she holds her breath. That was too much too soon. And that happens. Don't be like I messed up. You didn't mess up. Just adjust. All right. Anterior scalenes. Another fun way to work is kind of right here in the clavicle. So the clavicle, you shrug your shoulders, right? This joint here, that moves, right? So if you do this on yourself, right? Some people might get a crack out of it, right? Right here, the costoclavicular joint, that's a joint that moves. And for some people, if you get your fingers right in there, lots of proprioceptors and joint spaces, you can hang out in there, and if it feels helpful to them, go with it. Right? Might not for everybody. So right now I'm outlining her clavicle, and it's almost, I'm not doing it, but the idea is almost kind of like I want to get my fingers to touch around it. That's the intention. I'm not going to do that because that would be extremely brutal. All right, so I'm just kind of going in here. For anybody who is recovering and comfortable with this, really, really helpful. All right? And move slow so it's not so pokey. It's okay? Mm-hmm. And I'm also twisting it because, again, all those sensory receptors in the skin, that's what I'm communicating with, right? That's when you start thinking nervous system, you start aiming at different tissues, okay? All right, now, again, thoracic outlet. Right, a lot of times the entrapment might be right in here, okay? We're going to go for as much as we can. All right, now, anybody knows symptoms for thoracic outlet? So if I'm doing this, what should I have her alert me to? Because if you don't have the client say, hey, let me know if this replicates any numbness or tingling, because we don't want that, they won't tell you. I'm not kidding. I'll be like, oh, this is supposed to be happening, part of the therapy. No. Right, that's harming, not helping. So there's this thing, I don't know if you feel it, in your pec here. Feels like a muscle spasm, right? A little trigger point. That's your the plexus for the lateral pectoral nerve. I had once somebody rub it, I'm like, could you not do it? They're like, you have a trigger point there. I'm like, no, that's my nerve bundle. Like, don't do that. It can be extremely aggravating. So don't, again, this is why we don't need to pay attention to little meatballs, right? Do it. That feels gnarly. It's not pleasant. It's not a trigger point. Trigger point. Okay? And again, there's a difference between jamming this way and I'm going to do this here because I don't use my hands a lot and just kind of hanging out this way. I'm going to check in which feels more comfortable. Actually, let me.
That's
I'm
really
going to do
nice.
this, yeah. Right, and also being mindful of a woman's breast tissue. I don't want to jam into that uncomfortably. Okay. So ask me where it is. And again, what am I doing with her arm? And I'm just letting it flop. All those points of contact. Right, I'm covering it. And this is basically the game that I like to play. It's like, how much skin surface can I cover? This is those things, you know, those weighted blankets. I try to be a human weighted blanket for people, right? Within reason, of course. But again, covering all those bits, right? I never want her limb to feel like it has to work. This is working.
Mm-hmm.
This not so much. That's uncomfortable. Sorry. That's uncomfortable. I can do this. Sit like this a lot. I have the same thing, but now it's resting on my shoulder. For some people, for some practitioners, they're like, oh, I don't want to get that close. Wow. I don't mind at all. Okay? Tractioning here. Again, when we traction, not here. This is not, don't hyperextend. Get a little click out of it. Don't, this is not the worst thing in the world, but always keep a soft bend in it, and again, supportive. Right? Supportive. If this doesn't feel comfortable, there's other ways to do it. There's this way to do it. Right? But so they know you've got them. Like you got them here. When you start getting comfortable, you can open hands up for other things. Right? So that's that there. If they're comfortable with it, so sometimes you'll be working there, they're like, yeah, there's some numbness, tingling. What do I do?
Ask them if you want them to keep going.
Oh no. If they say there's numbness and tingling, what do I need to do?
Stop.
Or not stop, just
Change position.
adjust the angle, back off a little bit. Back off pressure-wise and angle-wise, and then I ask them to check back again. Is it still there or did it go? You're like, it's still there? Back off even more until it goes away. And then if like they're like, it's not going in, I'll be like, okay, let's work on the other side. Right? Get that. That's where a neurologist needs to look at it. But more often than not, they'll be like, okay, there it is. Work on it in that safe position and then reassess. 90% of the time, they're going to be like, oh yeah, it's cool there. Their nervous system's relaxed, not aggravating anymore. They feel safe. It's going to let go, and then you can go a little further. Right? Then you can go a little further this way, and you can work in this position. Again, see how I have her arm? This is not the worst thing in the world. This is fine too. Oh,
like
see?
it.
She doesn't like it. For her, it was the worst thing in the world. Thank you and sorry. Okay. Thank you and sorry. But you see how those little things that we take for granted, always here. And then always ask, is that okay? All right? And Nora is super flexible. Her arm goes there. It doesn't mean it enjoyed being there, right? So here, right? I want her to work. I might need to come up this way. Does this feel better here in this angle? Okay. She doesn't like the hyper flexion. Okay. So I'm going to work in this angle, and I can traction that way. And I have her arm, all these points of contact here. This is also working here. Why not? I have the traps there. Okay. Now if I have her here with this hand, sometimes if this is comfortable, I might just give it a hug here. Is that okay? All right. And move this way. When we do range of motion, again, I'm using my entire body. Right? This is nice too. I mean, this is always great to help them. Sometimes people are like, they want to help you. Sometimes it's not that they're protective, they're being helpful. And I'll ask, is that uncomfortable or are you helping me? Like I'm helping. Another nice way to stretch the neck in this position. You can't use it, squeeze your chair around. You have the luxury of that. Is this way. Okay, this is one way to do it. Here's another point of doing it. Okay. There's another point of doing it. And if you want to make it a little pointier, that's fine too. You can do it this way. There's a place for pointy. There's a place for pointy, accurate sensation like that. I do think sometimes it's like overused. It's like, and it's everything. Okay. And let me do the other side. Okay. So, first bit, have it here. Right. If I'm doing this and her arm's going with me, that's a lot of trust. And sometimes it's not you, somebody's just not there yet. It might take a few sessions for them to feel comfortable letting go. If they're helping too much, I just do something else, right? So here. So one small bit of traction. You can also work here. Sometimes work behind the ear. That's a very sweet spot that gets ignored. The little kitty spot. Right? It's a very like maternal sensation about that. Right? So here, 1, 2. Slide that down here. If that doesn't feel comfortable or like you really have to work to hold it, just come under the arm here. There. And again, if you have a lot of oil on your hands, it's a little trickier. Okay, here. Here, that'll get a little bit more traction with the elbow also. And then you can add counter force this way. You can always twisting your body like that spreading motion. And here. And if you want to add a more accurate point there, here. Once you get comfortable, then you can start adding a bit there without it feeling invasive or unsafe. Okay. Ranges of motion here. And then. That's fun. Cool. Thank you, Laura.
Thank you.
You got some stuff to play with?